My name is Shtern. I'm a physician and president of the AdMeTech Foundation, a nonprofit organization leading regional, national, and global programs in prostate cancer education, research, public awareness, advocacy, and clinical care equity. I'd like to express my gratitude to Bishop Talbert Swan for the opportunity to present this prostate cancer information at the annual Freedom Fund dinner of the Springfield NAACP. It is particularly important for us to present this information in Hampden County, where Black and Hispanic men have the state's highest mortality or probability of losing their lives to prostate cancer. The main goal of my presentation is to review recent advances in screening, diagnosis, and treatment, and our prostate cancer equity program established to bring this cutting-edge patient care to Massachusetts men and eliminate health disparities. Prostate Cancer Equity Program is an integral part of the AdMeTech's ongoing statewide program in prostate cancer that created a Massachusetts model of national leadership in public awareness, medical education, and research. We are grateful to Senators Adam Gomez and Jake Oliveira, Representatives Beth Williams, Carlos Gonzalez, Angela Popola, Brian Ash, and many other members of the Hampden County delegation to the Massachusetts State House, who have become our program's legislative champions. The primary focus of our program is on high-risk men, Black, Hispanic, and Latino individuals, and all men with family history of prostate cancer and increasing age, 50 and older. For public awareness and education, our messaging centered on the importance of screening and early detection critical for saving lives. Early detection is particularly important for Black, including Hispanic men, who are 2.5 times more likely to die compared to white men. With early detection of prostate cancer, every man is alive in 5 years. In sharp contrast, with late diagnosis, when cancer is spread to other organs, only 28% of men remain alive during the same period of time. The centerpiece of AdMeTech's medical education is annual Global Summit on Precision Diagnosis and Treatment of Prostate Cancer. Our summit has been recognized as a seminal event in shaping the state-of-the-art and future vision for patient care. Our summit brings together the key international experts representing every clinical expertise to review the best emerging clinical practices. The latest 7th annual conference took place only a few weeks ago. This educational event showed rapid advances in patient care. In screening, our summit supports clinical practice guidelines recommended by the National Comprehensive Cancer Network, consisting of over 28 leading cancer hospitals and their experts. High-risk men, including Black men, and any individuals with family history of prostate cancer are recommended to initiate discussions with their doctors about screening with PSA blood test at the age of 40. Average risk men should start screening at the age of 45. The first or baseline screening test in younger men is important for identifying men at risk of lethal prostate cancer long-term, over 10 years. In diagnostics, we have seen emergence of very accurate non-invasive tools, such as blood, urine, and saliva analysis for molecular and genetic markers, and advanced imaging, including ultrasound, MRI, molecular imaging. This non-invasive diagnostics highlighted the importance of PSA screening and shifted past concerns about screening into a dustbin of history. For example, this diagnostic test can determine which specific individual man has an increased risk of life-threatening, rapidly progressing prostate cancer, improve early detection critical for saving lives, reduce unnecessary procedures such as biopsies and treatment, and optimize selection of personalized precision care for each man, including careful observation or active surveillance, minimally invasive, what we call focal interventions, when only a tumor or a part of the prostate is treated, or radical interventions when the entire prostate is treated with or without systemic drugs. High-risk individuals, including Black men, carry higher risk of both mortality and unnecessary procedures. Consequently, it is critical for them to have access to precision diagnostics that determine for each individual man if he should or should not have invasive biopsy or treatment, and what options in clinical care are best for him. Unfortunately, in Massachusetts, compared to white men, Black men are less likely to have precision diagnostics such as advanced imaging, molecular or genetic testing, and to undergo life-saving treatment. Prior to undergoing invasive biopsy or treatment, it is important for each man to discuss with his doctor if any testing is available to determine if these procedures are actually needed, and if yes, what kind of options would work best for him. For example, in this slide, MRI shows prostate cancer lesions and guides biopsy needles with precision. AdMeTech has led research, development, and large-scale implementation of prostate MRI since 1998. In 2013, Massachusetts legislature funded clinical trial of prostate MRI, which produced groundbreaking data that were presented at the summit in 2016. By early 2017, about 6 months later, MRI was recommended as the new standard of patient care prior to biopsy and prior to treatment. Our summit highlighted the importance of MRI in Black men who are likely to have lesions in the front part of the prostate that are difficult to find by physical exam or standard blind biopsies performed without accurate imaging. In men with prostate cancer, there are two pillars of the current diagnostics: MRI and genetics. While MRI shows cancer location and local spread or stage, genetic analysis of cancer tissue reveals underlying biology and probability of progression. Emerging data indicate the importance of genetic testing for high-risk men, Black men in particular, for selecting the most effective and appropriate treatment. With this precision diagnostics, we can now accurately determine if each individual has a slow-growing, harmless disease and needs only careful observation or minimally invasive procedures, or an aggressive prostate cancer requiring immediate life-saving treatment. More recently, molecular imaging has been shown to play an important role in staging of prostate cancer, including presence of metastatic disease and detecting return of prostate cancer after treatment. For example, molecular imaging with PSMA has become available at the Dana-Farber Cancer Institute since August 2021. On the left, right here, we can see a regular bone scan that shows no metastatic disease. On the right, however, we have molecular imaging that demonstrates extensive metastasis on the same patient. This information is important for selecting appropriate treatment. We are proud to have led research and development of molecular imaging since 2001. Our summit concluded that equal access to high-quality care is the key factor in improving patient outcomes for all men and eliminating health disparities in Black men. It is particularly important now with so many novel diagnostic and therapeutic approaches, ensuring high-quality, personalized patient care. Without equal access to these advances in patient care, we will see a widening gap in inequalities, including survival and mortality. Consequently, AdMeTech launched the Prostate Cancer Equity Program in Massachusetts in collaboration with Mass General Brigham, UMass, and other clinical institutions, with the mission to save lives and deliver high-quality care. Supporting organizations include Latino Health Insurance Program and NAACP New England Area Conference, with their multiple branches located across the state. Any Massachusetts man age 40 and older can take part in this program. Our priority focus is on Black, Hispanic, and Latino men who are at high risk of prostate cancer, delayed diagnosis, poor quality care, and death. Our goal is to expedite access to leading experts who use the most advanced approaches to screening, diagnosis, and treatment available today, and to support men every step of their medical journey. This program helps men to find an expert for the initial or a second opinion, in-person or virtual visits. We believe that in Massachusetts, with its leading hospitals and universal access to care, our prostate cancer equity program will be able to eliminate health disparities. Experts of the prostate cancer equity program can address any questions about prostate health, from assessing an individual healthy man's personal risk of cancer to informing men about all available options before and after screening, biopsies, and treatment. We are committed to supporting men during every step of their medical journey to ensure that no man is left behind or struggling alone. To achieve this goal, we created a streamlined VIP-style process of patient referral and care, reflecting how doctors involved in this program take care of our families and friends. This process consists of three essential components. AdMeTech Foundation's team members collect basic information and match individual patient needs with the appropriate state's experts for clinical care. A clinical organization designates a patient navigator to expedite a medical visit and related needs, including scheduling, registration, transportation, and financial assistance if needed. If an expert recommends any next steps, such as, for example, further diagnostic, evaluation, or treatment, AdMeTech's team and patient navigator work with men on the appropriate follow-up. We asked a few men to share their experience with prostate cancer equity program. The first video was provided by Jose Javier of Lawrence, Massachusetts.
Hello, everyone. My name is Jose Javier. First, let me begin by thanking Dr. Shtern for inviting me here today and being part of this. I'm excited to share with you and grateful to be able to share with you for a few minutes a little bit about my story and my experience with AdMeTech in the organization. I met Dr. Shtern around the fall of 2015. I heard about her from a friend of mine at church, Victor McCann, which I'm grateful for because he was going through the same thing. And he was able to share at church, and I heard his testimony, and I was able to approach him after the service, and we had a great conversation. I was very shy about this subject. I too had a very high count of my PSA exam and had to go in for a biopsy. And I learned from Victor McCain the difference between an MRI biopsy, a guided biopsy, and also what is referred to as a blind biopsy. And those made a difference in my life. And I was able to meet Dr. Shtern through this process. And I was able to go in, get a MRI guided biopsy at the NIH and so forth. And it was a fantastic experience for me. So for me, part of the takeaway when it comes to this is really to be aware. Be aware, learn about the processes, learn what's available out there, what programs are available for you, what are the best tools to do the job. A very important thing is to share it. That's what I learned from my friend Victor, is to share it at church, share it with other people so they can learn as well. And because in our community, especially in the Black American community and the Latino community, it's a subject that is not often spoke about. When we talk about our private parts and speaking about the prostate, it's not always a conversation that is too welcoming in our community. So I would encourage people to share it, to learn. And as Governor Baker always says, get tested. It's easy to get tested. Ask your doctor for a test and be aware and that there are solutions out there. We have great referrals We have great doctors, and contact the leadership, the people at AdMeTech, and they're able to guide you in the right direction. Thank you. Please allow me to say a few words in Spanish. Para nuestra comunidad en español, este tema de cáncer en la próstata es un tema súper serio, muy serio, y es un tema que nos impacta a nuestra comunidad significantemente. Yo le quería decir a ustedes que, por favor, hablen con su médico si sienten algún síntoma, si están teniendo problemas orinando, cualquier irregularidades. Hablen con su médico, no tengan miedo de conversar con su médico. Hablen con personas que tienen experiencias similares y eso le puede salvar su vida. Lo más importante es hacerse un examen PSA. Por favor, estudienlo bien y aprendan más. Gracias.
The second video features Ken Reeves, president of the Cambridge NACP, who was referred to us by the NACP New England Area Conference.
My name is Kenneth Reeves. I am the president of the Cambridge branch of the NAACP, as well as the former mayor of the city of Cambridge, Massachusetts. My intention is to say a word about the AdMeTech Foundation and its offerings and benefits, particularly to communities of color and particularly to Black men facing issues with respect to prostate cancer. I would say that in Cambridge, we've been in the men of color health business for more than 25 years. And so we have a men of color health outreach. However, I think we've become much more knowledgeable about ways in which we can assist the men of our city. And we particularly have become much more knowledgeable about prostate cancer and its impact on particularly Black men, who are 5 times as likely to be affected by prostate cancer than white men. So that being the case, and I've dealt with prostate cancer theoretically, and then 4 years ago, I was diagnosed with prostate cancer. So I have my own journey. And after diagnosis, I was able to hear what my treatment options were. And I chose something called CyberKnife, which is a 6-day treatment where you go every day for about an hour. There is a laser approach to the cancer. And after that, I was able to be clear for almost 2 years. And then suddenly my PSA, or prostate specific antigen number, kept going up, and no one could figure out why. And I had many MRIs and other tests. And that's when I met AdMeTech, because I was describing this to a friend, and they said, "It sounds like you're lost in the maze of, what to do when your numbers are inexplicable." So I was in touch with our Dr. Shtern, and basically I had to tell her there is a test that they don't have in Boston that I need to have. It's an imaging test. It's very advanced. It's in Europe, but not yet approved by the FDA. And she said, "I'll get it for you." And she was able to arrange it through Sloan Kettering in New York. So after much red tape and bureaucracy, I was able to get that imaging test, and it did find where the prostate cancer had moved to an area around my lung, which my doctor, who's a very important, famous department head at Dana-Farber, said he had only seen one case in his career, so he was pretty sure it wasn't to the lung. So I then learned that, the physicians are great, but they're not God. So I called him and said, "Guess what? I'm number 2. And after being number 2, I still have had to have these various questions that I don't feel competent to answer about what next steps should be in my medical care. So while I have a wonderful team at Dana-Farber, who Dr. Shtern led me to, but even in all that wonderfulness, there are questions that I don't feel competent to answer. So she just 2 days ago helped me to answer 2 great big questions. So I think this is timely for you to hear that. In my big questions were whether I should participate in a particular study, which would, I'm now on a very expensive pill that has my PSA number at 00000. So this is $16,000 a month. And the question asked of me by a doctor is would I would participate in a trial which would essentially stop this pill, let the cancer come back, and then observe what that does with respect to the testosterone level. And the doctor also said, well, we don't get many Black men in trials, so we'd like to get it would be important if you were to say yes. And so this was hanging over my head like a cloud. I couldn't decide because I want to do whatever I can do that will be helpful to both science and to prostate cancer with respect to Black men, because self-interest is a wonderful motivator. Her immediate reaction was, not for you, because you had one of only 2 cases with your particular doctor. The experience with people like you for such a trial is too small. And so you should be very thankful to the doctor, but it's not for you. Thank God for having a foundation that's devoted to navigating men of color through the maze of prostate cancer to be able, with a scientific point of view, give that kind of direction and consultation. So I must say that is great. I also got to talk to her about a second thing, had to do with neuropathy. And so I went to a neuropathy doctor who was the head of neuropathy at the Brigham and at Dana-Farber. I got a clean bill of health, meaning that whatever neuropathy I have is appropriate for my age and for my diabetic status. But then Dr. Shtern introduced the issue of vascular. The neuropathy is basically your hands and feet. The vascular is the veins in your legs going down to feet. She suggested, well, maybe you want to see a vascular person too to get the fullest picture of what's going on with the circulation. Trust me, I have a lot of education and a lot of good exposures, but I think what AdMeTech is offering is the possibility to get the best advice for the best care possible at this time. And I want all men of color in Massachusetts to have that. So I couldn't recommend this program more highly based on my own personal experience and those people who I can recommend. This is my story and my song, but I must say that I have been very much helped by the advice and direction and management of AdMeTech.
Emma Coyard serves as a manager of the Prostate Cancer Equity Program. Emma is assisted by Erin Roberts, program coordinator, Craig McClay, patient educator, and other members of the AdMeTech Foundation's team. When you come to us, Emma will work with you, our team, Mass General Brigham, other clinical partners, to expedite medical visits and address any needs you may have. Our team may not be able to right every social wrong that cannot be resolved effectively by federal or state government, or provide perfect solutions for every man. And yet, we are committed to doing our best and making sure men are not left behind or struggling alone. If you have any questions or need assistance, please contact Emma. She can be contacted by phone 617-523-3535 or by email coordinator@admetechfoundation.org. Thank you for your attention.